The Victorian Government acknowledges Aboriginal traditional owners of country throughout Victoria and pays respect to their cultures and elders past, present and emerging.
We all want to keep our children safe.
No matter how old or young they are.
It's a good reason to do a first aid course.
So we can help our kids and others if they need urgent care. Even babies can need first aid, so this video covers the common health emergencies for babies under 12 months, what to do if they happen, how to get help by calling 000, how to perform cardiopulmonary resuscitation, or simply CPR, and how to learn more about first aid.
The most common causes for babies to go to hospital include SIDS and sleeping accidents, choking, cuts, poisoning and burns, and there are many others. They can all be serious, even life-threatening, so time is critical. Knowing what to do and doing it straight away gives baby the greatest chance of surviving.
In an emergency, call 000. Calling for an ambulance could mean the difference between life and death. However, people sometimes hesitate to call because they are not sure if the situation qualifies as an emergency. If in doubt, always call 000. The people who take your call are trained to help you and will direct you to the appropriate resources. An immediate life-threatening emergency for a baby can include burns, serious accidents or trauma, severe bleeding, difficulty breathing or no breathing, and unconsciousness. The 000 operator will ask,
"Police, fire or ambulance?"
If you are calling from a mobile, they will ask which state you are calling from so that you can be connected to the right 000 service. The 000 operator will then ask you two questions. Where is your emergency and what is your emergency? Try to be as clear and correct as possible in your answers.
"I'm at 2 High Street, Shepparton, Victoria. My baby isn't breathing."
As soon as the operator knows where you are and what the emergency is, they can start to send the right kind of help. They will ask you some other questions too, so they can pass on the clearest possible information to the emergency responders. It may seem like the operator wants too much detail or it's taking too long, but they are highly trained and know exactly what to ask you. Responding to them won't slow down the emergency response.
If your baby is unconscious and not breathing normally, they need CPR. First, look for the source of any danger and make sure you and the baby are safe from it. Now, check for any response from the baby. Speak loudly, gently squeeze their shoulders or tickle their feet. Stimulus should be firm enough to wake a sleeping child. If there is no response, call 000 or get someone else to. Don't leave the baby unattended. The operator will give you over the phone CPR instructions for you to follow until the emergency services arrive. Check if the baby's nose, mouth and throat are clear. If not, remove any blockage, such as vomit, blood, food or loose teeth. Ensure the head is in a neutral position, with the head and neck in line and not tilted. Is the baby breathing abnormally, grunting, gasping, or not breathing at all? If they are breathing normally, move them into the recovery position and stay with them. If the baby is unconscious and not breathing normally, start CPR as soon as possible after calling for help. CPR consists of 2 actions, 30 chest compressions followed by 2 breaths of mouth to mouth. Aim for 5 sets of 30 to 2 in about 2 minutes. Lie the baby on their back. To carry out chest compressions on a baby, place 2 fingers on the lower half of the baby's breastbone in the middle of their chest and press down by 1/3 of the depth of the chest. You might need to use 1 hand rather than 2 fingers for babies over 6 months, depending on their size. Now, release the pressure, allowing the chest to return to its resting position between each compression. Pressing down, then releasing counts as 1 compression. Ensure the baby's head is in a neutral position, with the head and neck in line and not tilted. Tilting a baby's head may limit air getting into the lungs. Lift the baby's chin, being careful not to rest your hands on their throat as this may stop air getting into their lungs. Take a breath. Then cover the baby's mouth and nose with your mouth, ensuring a good seal. Blow gently for about 1 second, watching for the chest to rise. After each breath, watch for the baby's chest to fall. Listen and feel for signs that air is being expelled by placing your ear and face close to the baby's mouth and nose. If the chest does not rise, check the baby's mouth and nose again and remove any obstructions. Make sure their head is in a neutral position and that there is a firm seal around the mouth and nose with no air escaping. Continue to give 30 compressions followed by 2 breaths, which is known as 30 to 2. Aim for 5 sets of 30 to 2 in about 2 minutes. Keep going with 30 compressions, then 2 breaths until the baby recovers, that is, they start moving, breathing normally, coughing or crying, then put them in the recovery position, or first responders arrive and take over. Remember, keep going. If you can't give breaths, doing compressions only without stopping could still save a baby's life. Remember, any attempt at CPR is better than no attempt at all.
First aid isn't just for simple injuries like cuts and scrapes. If there's an emergency, first aid can mean the difference between life and death. So it pays to have first aid skills because it will make dealing with an emergency easier.
Consider taking a first aid training course and follow up with a refresher course every 3 years. There are many providers of first aid courses available in Victoria. Check with your midwife, your GP or your maternal child health nurse for details, or go to betterhealth.vic.gov.au.
More child health and safety information is available from raisingchildren.net.au, kidssafevic.com.au and rednose.org.au.
In an emergency, knowing some basic first aid could help you to save a life.